Did you know that your risk of dementia could depend on your ethnicity? Today, we're diving deep into the surprising and often overlooked connections between ethnicity, environment, genetics, and dementia. What we uncover might change the way you think about brain health forever. Let's get started. Dementia doesn't affect all ethnic groups equally. Research shows differences in who gets it and how early. The highest risks are found in Black, Caribbean, Latino, and Native American communities. Medium risk are in Latinx, Mexican American, and non-Hispanic white populations. Lowest risk are in Japanese and Asian American populations. But why these differences? It's not just genes, it's a complex puzzle. You've probably heard of the ApoE4 gene, a known risk factor for Alzheimer's. But it turns out it doesn't tell the whole story. The gene doesn't affect all ethnic groups the same way. Differences in genetic ancestry, like African versus European descent, may play a role. And many biomarkers we use to detect dementia, they are developed mostly in white populations, which raises big questions about accuracy and equity. Let's talk about the world around us. Where we live, how we live, and what we're exposed to can all impact dementia risk. Chronic stress, pollution, poor diet, low education, and limited healthcare access hit some communities harder. Social disadvantages like poverty and isolation are linked to cognitive decline. In fact, poor education quality alone may explain half of the racial disparities in the US dementia cases. To learn more about the modifiable risk factors for dementia, watch this video. Even when people seek help, the healthcare system doesn't always serve everyone equally. Minority groups are underdiagnosed and underrepresented in research. Many screening tools don't account for cultural or educational differences. And most dementia prevention trials, over 60% don't even report participants' ethnicity. Here's a twist. Studies in the UK and US found that people who got the shingles vaccine had up to 20% lower risk of developing dementia. But these studies didn't break down results by ethnicity. And vaccinated individuals often have better access to care, which could skew the results. So what do we do with all this information? Tailored prevention. Different communities need different solutions. Better representation in research and clinical trials. Culturally adapted interventions co-designed with local communities are proven to work. Policy changes that tackle root causes, such as education, pollution, diet, and access to care. Dementia is not just a health issue, it's a social justice issue. By understanding how ethnicity, environment, and inequality shape brain health, we can build a future where everyone has a fair chance at a healthy mind. If you found this eye-opening, give it a like, share with a friend, and hit that subscribe button. Let's raise awareness and drive change together.